As you heard earlier in this program, chemotherapy is a powerful weapon in your fight against cancer. However, a potential side effect of strong chemotherapy is that it can decrease the number of white blood cells, called neutrophils, in your blood, making you more at risk for infection. But there is a treatment option available that may help to prevent this from happening. As you and your doctor have already discussed, your doctor has ordered Neulasta, pegfilgrastim, for you. Neulasta is a prescription medication used to reduce the risk of infection, initially marked by fever, in patients with some tumors receiving strong chemotherapy that decreases the number of infection-fighting white blood cells. Neulasta is a type of medication called a granulocyte colony stimulating factor, GCSF, which means it can increase or boost your white blood cell count. When Neulasta is given, it results in an increase in the number of new white blood cells that are formed. As these white blood cells develop, they produce sacs that contain substances needed to fight infection-causing bacteria. Neulasta helps speed the recovery of your white blood cells. Neulasta stays in the body long enough to help protect you through each chemotherapy cycle. This means you only need one Neulasta injection per treatment cycle, given 24 hours after you have your chemotherapy and not more than 14 days prior to your next chemotherapy cycle. You should not take Neulasta if you have had an allergic reaction to Neulasta or to a similar medication called Neupogen, filgrastim. Neulasta is used in patients with solid tumors, sometimes referred to as non-myeloid cancers, receiving strong chemotherapy, including breast and lung cancer patients, as well as patients with lymphomas. When given after every chemotherapy cycle, Neulasta can help protect patients with these types of cancers from infections. If you feel pain in the left upper part of your stomach or left shoulder tip pain, call right away, as this could mean your spleen is enlarged or has ruptured. Neulasta is given after every cycle of strong chemotherapy, beginning with your first cycle. It is given by injection under the skin at least 24 hours after each cycle, and not during the 14 days before the next dose of chemotherapy. The injection is usually given by your doctor or a nurse in the practice. You may experience pain or redness at the injection site. Call your doctor if you develop swelling or bruising that does not go away. While you are taking Neulasta, you may have blood tests to monitor your white blood cell count, also called your neutrophil count. An increase in the number of neutrophils in your blood will tell your doctor if Neulasta is working for you. You should call your doctor or seek emergency assistance if you develop problems breathing, experience swelling around your mouth, your heart beats fast, or you develop hives, as this may be a reaction to Neulasta. The most common side effect patients may experience with Neulasta is aching in the bones and muscles. It can usually be treated with non-aspirin pain relievers like acetaminophen. If you experience any aches or pains while taking Neulasta, please let your doctor know. Before starting Neulasta, please let your doctor know about all other medications you are taking, including medicines you buy without a prescription. In addition, let your doctor know about all of your medical conditions, especially if you have sickle cell disorder. For more information about Neulasta, visit www.neulasta.com. You will also receive a copy of the prescribing information included with this video.
Neulasta, pegfilgrastim, is not for everyone. You should not take Neulasta if you have ever had an allergic reaction to Neulasta or to Neupogen. Tell your doctor about all of your medical conditions, especially if you have sickle cell disorder. Serious side effects have been reported in some patients taking Neulasta, which should be reported to your doctor immediately, including spleen rupture. Report left upper stomach or left shoulder tip pain to your doctor right away. A lung problem called adult respiratory distress syndrome, which may cause you to have trouble breathing. A serious allergic reaction that can result in difficulty breathing, wheezing, swelling around your eyes or mouth, fast pulse and hives, and patients with sickle cell disorder may have a serious sickle cell crisis. The most common side effect of Neulasta is aching in the bones and muscles. This can usually be treated with non-aspirin pain reliever, such as acetaminophen. If you have any questions about this information, be sure to discuss them with your doctor. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.